So PrEP is a medication that is used for the prevention of HIV transmission. It's used really to protect someone. So they can take PrEP really every day, once a day, to prevent the HIV transmission from occurring. The way this particular medication works that we use for PrEP, it works by stopping replication of HIV, so preventing HIV from making more copies of itself in the body. And so if we get it in the body ahead of time before, hence the pre-exposure, if we get it in the body before, what happens is we've already shut down the process that would allow the replication to occur. And so once HIV is introduced into the body, it cannot make more copies of itself because we've shut down the process by which it does that. Yes, PrEP is safe. Of course, there may be side effects with PrEP, so we have to make sure that we're monitoring for any kind of kidney function and looking out for any other side effects, sometimes headache, maybe a little bit of upset stomach, initially in the beginning, but overall PrEP is very safe. So who is a good candidate for PrEP? So this is an interesting question. Lots of times we go based off of like CDC recommendations, so someone who's considered at high risk for contracting HIV, so someone maybe who has multiple sexual partners or possibly engages in condomless sex or little to no condom use during sexual encounters. But I think PrEP really can be used for anybody who wants to protect themselves, who wants to make sure that regardless of what is going on in their day-to-day life, that they are protected from HIV. So the protocol is really simple. Anyone can prescribe PrEP depending on their comfort level. So the provider would just really need to screen the patient, decide if they think the patient is a good candidate for PrEP or if the patient believes they're a good candidate for PrEP. Making sure that they're going to be someone who's going to be adherent to the medication. So that's very important, very key to PrEP being effective. Taking the medication once a day, every day, not missing doses is going to be important. So having that conversation up front to make sure that the person is ready to really commit and be on PrEP and do well. The other thing is that we do want to make sure that we are checking those labs. So we talked a little bit before about PrEP and its safety. We have to make sure that it's doing well because obviously every person is different, everybody's body is different. And so we just want to make sure that PrEP is working the way it needs to in the body, and then also make sure that it's not doing any harm to the body. So we check labs every 3 months to make sure that we're not having any renal function issues, but also looking to make sure that PrEP is still effective and make sure that we haven't contracted HIV during that time frame or looking for other STIs. PrEP can be accessed several ways. So for a patient who is insured, meaning they have some type of insurance plan, prescription coverage, we can always typically get it covered through the insurance company. And then if there's a little bit of issues with affordability of copays, the company who makes the medication has a very great assistance program, copay card, where patients can be signed up for that card and get the medication at no cost to them. So the copay gets covered. For someone who is uninsured, they can get the medication at no charge to them through the company who makes the medication. So what happens typically is they get signed up for a PAP program, patient assistance program, and that program allows the medication to be either shipped to the patient's home if they would like, or they can pick it up at a local pharmacy that accepts the program information. So they're very generous in that they allow up to 400 times the federal poverty limit for income.